Hello everyone, my name is Dr. Ferox. I've just come home from work and I wanted to talk a little bit about fine needle aspirates from a pet owner's perspective because we do them all the time. I've done, I think, 4 of them today and they're super useful from a diagnostic point of view. A fine needle aspirate is done with a fine needle, pretty similar to the sort of needle you would use for a vaccine or most other injections. But we do it for a diagnostic purpose. So it is functionally a really tiny biopsy. Instead of cutting out a whole chunk, which might be 3-5 millimeters or a whole lump, we take just a tiny little sample to give us an idea about whether the lump is scary looking or whether it doesn't look so bad. And that informs our treatment choices down the track. So I'll show you what I mean. Now I'm going to pretend that this apple is a mystery lump and I want to know a little bit about what's inside it. Because just feeling from the outside, you can't actually tell if that's benign or malignant. Sometimes you have a clue or a suspicion, but you never actually know until you've seen some cells under the microscope. So if I take my fine needle, I'm going to try and aspirate a sample from it, which means we go in. We might go in a couple of times at slightly different angles, trying to get a broad sample, and we might pull back, which is to aspirate a little. So it's a pretty little sample, and then I'm very carefully going to avoid sucking through the needle, put in a little bit of air, and squirt out the contents onto the slide. Now, from an apple, you would expect that you get quite a lot of juice, but you'll also get some chunkier portions which are full of cells that you can look at under the microscope. Now, the benefits of this is that a fine needle aspirate is fast. It's unlikely to be painful in most locations, and it's cheap compared to a surgical biopsy. In a vet clinic, I will often go look at that slide straight away, so the owner is waiting only about 10 minutes to know whether I think the lump is scary or not scary. Because if you're potentially talking about cancer, you don't want to wait any longer than you have to. So once I have my sample on the slide, in a clinic I would then stain it with Diff-Quik, which is a purple and pink stain that we use most of the time because it's quick. It takes about 30 seconds to get this ready to look at under the microscope, because otherwise a lot of cells are just transparent. Not red blood cells and not melanocytes, but most of them don't have a lot going for them otherwise. Diff-Quik lets me actually see the shape of cells, and sometimes you can tell exactly what type they are, particularly for the common things. Specialist pathologists will have additional stains they can use to immunotype and all that fancy sort of stuff. But in a clinic, I want my answer in 30 seconds. There are lots of different things that we can see down the microscope, which is why we're looking in the first place. But here are 3 relatively common examples that I've collected from fine needle aspirates in dog lumps. First is our friend, the lipoma, which is something I'm always happy to see. These are fatty lumps. They're generally benign, but sometimes inconvenient. They often aspirate quite a large volume of fluid, but only a relatively small number of cells end up staining, because they're made of fat mostly, and the blue fixative dissolves the fat. So you end up with these ghost cells that are just an outline, with all the contents missing. Often these cells are a little bit irregular in their size, so they're big ones next to small ones, and you often find them clustered around each other. They are almost always benign, usually don't get much bigger than an egg, but occasionally get to a kilo or 2, which is inconvenient for the dog. It is incredibly rare to see a non-benign one, which is either a liposarcoma or an infiltrative lipoma. And in 15 years of practice, I've only seen one infiltrative lipoma. Unfortunately, you can't actually differentiate the incredibly rare malignant one from the benign one without a bigger biopsy. Next, I have some spindle cells. These cells kind of have a big nucleus in the middle and then two tendrils coming out either side, and they usually stack on top of each other like bricks. They are a lot harder to find because they are better attached to their surrounding cells. But when you do find them, the bigger the nucleus, the more concerning they are. And they could be just about anything. They could range from a benign fibroma to a nasty fibrosarcoma to even scraps from a hemangiosarcoma if you're really unlucky and there was a lot of blood. It's certainly not within my skill set to be able to know exactly what these are, but they are concerning enough to justify biopsy or removal. And last but certainly not least, we have the thing we dread, mast cell tumours. The only good thing about a mast cell tumour is that it's usually easy to find with a fine needle aspirate. And honestly, that's what I do most of them for, to make sure that that mystery lump is not, in fact, one of these. Mast cells are very round cells, so they shed easily into the needle. They are full of very distinct granules, and they're really obvious when you see them. They are almost always bad news. In fact, you assume they are very bad news and do your best anyway and hope for a better outcome than you were expecting. Occasionally, histiocytomas look very similar, but they are not as common. And if in doubt, you can always send this sample off to a pathologist to confirm whether it is the histiocytoma, which is quite benign, or the dreaded mast cell tumour. They will have very little difficulty telling you what to do about it. So if you're not sure exactly what you're looking at, there's a few features that can suggest what you're looking at is a bad thing. The bigger the cells, the more likely they are to be neoplastic, especially if they have very big nuclei or very active nuclei. And if you see lots of cells actively dividing, especially any with a triple or quadruple nucleus, they are probably bad signs. If you've only taken an FNA with a tiny little needle, while you do get some cells to look at and it's a great start, sometimes it's not enough. This is a jam donut. You know there's jam inside the middle of it, but if you only take a sample with a tiny, tiny little needle, it's entirely possible to miss the jam. So sometimes a pathologist will say, I don't know what this is, I need more information. Your next option is cutting out a wedge or a punch, because if you cut out a big slice, you should be able to get a representation of everything that's in that lump. And failing that, you can still send them the whole thing. But those last two options require surgery and a general anaesthetic. The benefits of a fine needle aspirate are that it's fast, it's cheap, and you can do it in a conscious dog. And if you don't know exactly what you're looking at, you can still send that sample away to a pathologist, so it's easy to get a second opinion. Doesn't always tell you everything you need, but it usually gets you started on the right track. My name is Dr. Ferox. I hope that little bit of information was helpful and that you weren't too freaked out by seeing tiny little needles. I hope to see you in the next video. Bye.